بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. I am Dr. Ahmed Rajab. Our subject is about menopause. Menopause is one of reproductive endocrinology changes occurring during the female's life. Let us to remind you about the physiology of female sex hormones. No normal changes occurring at puberty. Define menopause, climacteric and abnormal menopause, and no normal changes occurring at menopause. And lastly, describe abnormal types or changes occurring at menopause and how to treat each of any. Regarding the starting of the female's reproductive life, it starts at puberty by action of the hypothalamo-pituitary-ovarian axis. If you remember, the hypothalamus produces gonadotropin-releasing hormone, which is termed also luteinizing hormone-releasing hormone, as it stimulates LH more than FSH release. This gonadotropin-releasing hormone passes via the hypophyseal portal circulation to stimulate the anterior pituitary for release of FSH and LH. The follicle-stimulating hormone and LH act on the ovary in cyclic manner, starting by FSH for the first half of the cycle to stimulate growth and the maturation of the growing follicle to produce one primordial, changes it into dominant follicle, releasing estrogen. Now, this dominant follicle acts upon by LH for rupture, means ovulation and releasing of progesterone. At the end, the released ovum may be fertilized and a pregnancy will occur, or no fertilization occur. What happens as a general, local, or central changes in response to these hormones, estrogen and progesterone? Estrogen actually is the main female sex hormone responsible for most of pubertal changes. Estrogen leads to local action, general action, and central action. On the genital tract, if you remember, estrogen increases vascularity and increase blood supply of all organs of the female genital tract and pelvis, including the muscles, pelvic fascia, and skin of the vulva, leading to softening of the whole genital tract. On the uterus, it is responsible for the first half of menstrual cycle by causing proliferation and hyperplasia of the endometrium. On the tubes, it causes increased motility and vascularity. In the ovary, it helps in the mechanism of ovulation by negative feedback mechanism with FSH and positive with LH. On the cervix, it causes positive sperm and ferning. On the vagina, it causes proliferation of the epithelial lining, increasing vaginal acidity by stimulating the duodenal bacilli or lactobacilli to convert glycogen into lactic acid. Progesterone again. Progesterone has local action, general action, and central action. On the uterus, it is responsible for the secretory endometrium or the CDOL changes during early pregnancy and also uterine relaxation during pregnancy. On the tubes, it causes decreased tubal motility. On the cervix, it turns positive sperm and ferning effect of estrogen into negative one and causes progesterone cervical mucus to be more and more thickened to close the cervix during pregnancy. Then, progesterone centrally inhibits LH and stimulates FSH, and on the general effects, it causes increased body temperature by about 0.5 degrees centigrade, so it has thermogenic effect. A female should experience a normal increase in body temperature during the second half cycle. On the breast, it causes more and more development of the alveolar system together with the estrogen. Both are responsible for development of the breast and enlargement at puberty. And on smooth muscles of the body, it causes relaxation. Remember, these changes occurring in hormones during the reproductive years. Here is the estrogen, LH, and estrogen related to each other. When estrogen increases, the LH increase. But when estrogen increases, FSH will decrease. And this is progesterone mainly manifested to increase during the second half of the cycle. Increases of estrogen again during the mid-luteal phase with progesterone. Both are decreased just before menstruation. This is show to you how the growing follicle maturate and how one ovulate. Multiple follicles start to grow. One only can reach maturity, named the dominant follicle, and then after rupture it is turned into corpus luteum, then corpus albicans. As an effect of these previous mentioned hormones, mainly estrogen and progesterone, there are some general changes, local changes occurring in the female, leading to what's called puberty. Puberty is a period of life during which the female is changed from childhood to adulthood. Its time period about from 8, 9 up to 14 years. During this transitional stage, there may be some endocrinological changes by increasing central hormones, peripheral hormones, corticosteroids, thyroxine, and so. Developmental changes like growth spurt as an effect of estrogen and other growth hormones. Thylarch, which means breast development. Adrenarche, due to axillary hair and pubic hair development. And menarche, which means first spontaneous menstruation. Lastly, at the end of this stage, the girl have some psychological changes like shyness, refusing of parents' control, and tendency to other sex, or what's called sexual urge. This is breast development and pubic hair development. At the end of this transitional period from childhood to adulthood, this nice girl will be changed into this adolescent one, searching for her self-confidence, and lastly this mature female. This mature female lasts about 20, 30 up to 40 years. After this period, which is named childbearing period, the patient or the female passes to what's called. Now, what about menopause? Meno means menstruation and pause means stop. A menopause is a dramatic change occurring in the female's life. A menopause is a very sad thing or event that occurs at the end of the female's life, like this picture. Now, how can you define menopause? What is the normal age and factors affecting menopause, and normal changes occurring at menopause? Menopause is permanent cessation of menstruation for more than 12 months or for more than 1 year. So a patient complaining of 3 months amenorrhea, 6 months amenorrhea is not defined as menopause even at the age of 50 years or more. The normal age of menopause ranges from 45 up to 55 years, but the mean age is about 51 years in almost all of the world. The age of menopause doesn't depend on the age of menarche, climate, or environment. A premenopausal period is a 5 years period before the age of menopause. For example, this patient had menopause at the age of 45 years. She had 5 years from 40 up to 45 named premenopause. A postmenopausal period is that period including all the years after the year of cessation of menstruation in the female's life. For example, a patient had 52 years old. At this age, she had cessation of menstruation, and now she is 70 or 75. All of these years following the menopause is named postmenopause. The climacteric is the transitional period of life during which the female changes from reproductive to non-reproductive state. Remember with me the definition of puberty, a transitional period. Here, climacteric again is a transitional period. Perimenopause, including 5 years before and 5 years after the mean age of menopause. If our patient is 47 years old now, had menopause, so from 42 up. What are types of menopause and normal changes occurring at menopause? Menopause may be physiological or pathological. A physiological menopause are normal changes occurring by the previous definition and according its age with no need for treatment. But pathological menopause or abnormal menopause include premature menopause, artificial menopause, menopausal syndrome, and delayed menopause. Regarding normal hormonal changes occurring at the age of menopause, there is sudden and continuous increased level of FSH and LH as a result of withdrawal of estrogen and progesterone. So, presence of persistent high level of FSH more than 40 international units is diagnostic for menopause. Estrogen estradiol is completely depleted because there is no ovarian follicle, and the main type is E1, and the progesterone is markedly decreased. Androgen again is relatively increased. Inhibin coming from the ovary is decreased, and thyroxine is decreased. Looking to this photo, it shows the gradual increase of estrogen occurring during the female's life and its appearance at the age of menopause. Here at the age of 20s, rapid increase of estrogen, increase more and more. At the age of 35, it reaches its maximum. So the females at this photo full of estrogen and then gradually decrease markedly at the age of 50 and decrease. Looking to genital changes occurring, please remember the normal changes occurring at puberty. Its reverse will occur here. There is atrophy with narrowing of introits leading to dyspareunia, vagina more and more narrowing, thinning, atrophy, and loss of vaginal rugae, and associated decreased vaginal acidity leading to recurrent vaginitis. Cervix, more and more atrophy, flushing of the cervix with the vagina, increase the incidence of vaginal and cervical ulcers and erosion. The uterus become smaller, atrophic, and with atrophied endometrium. This atrophied endometrium and atrophied vagina, named senile vaginitis and senile endometritis, mostly associated with ischemia of the endometrium and the vaginal mucosa, leading to postmenopausal bleeding, and actually is considered as the commonest cause of postmenopausal bleeding. The ovaries atrophied with small shrunken ovaries and depletion of the follicles. There is pelvic floor and the ligaments more and more lax, leading to genital prolapse. Regarding general changes occurring, despite estrogen and progesterone were responsible for some psychological changes and breast changes, breast development, bone development, protection from ischemic heart disease. But now, at the age of menopause, due to depletion of these hormones, there is anxiety, depression, breast atrophy, and calcium mobilization from bones with subsequent osteopenia and osteoporosis. There is hair changes leading to weakness and grayness of hair, and increased low density lipoprotein and decreased high density lipoprotein with more liability for ischemic heart disease and hypertension. There is more and more wrinkling of the skin and vasomotor instability. This to remember, these changes of menopause occurring in this female, leading to anxiety, depression, headache, and osteopenia, followed by osteoporosis on long run. Yes, this lady at menopausal age, remember her life, and this lady is depressed and anxious, irritable about these changes occurring. The previous mentioned ones are normal changes occurring at menopause, but these normal changes could be tolerated with no treatment. Regarding abnormal menopause, there may be premature menopause, delayed menopause, menopausal syndrome. As premature menopause, it occurs as a cessation of menstruation before the age of 40 years, but again this cessation should involve at least 12 months or 1 year. It may be due to congenital causes, traumatic causes, inflammatory states, neoplasm, dysfunction, or induced artificial menopause. The congenital cause, as occurring with ovarian hypoplasia or mosaic Turner syndrome, this may have genetic and familial tendency. The hypoplastic ovary will deplete its follicles in a short period. So at the age of 30-35, these follicles will be depleted and the patient will develop menopause. Traumatic, like surgical removal of the ovary, for example due to ovarian malignancy, inflammatory condition leading to destruction of the ovary like TP, or neoplastic conditions as metastasis and so, or dysfunction as occurring with autoimmune disorder like systemic lupus erythematosus, or induced menopause or artificial menopause. All patients of premature menopause will develop menopausal syndrome and menopausal state before the age of 40 years, and all of this needs treatment by hormone replacement therapy. Artificial menopause or induced menopause, again, it means destruction of the ovarian follicle before the age of natural menopause, before the age of 45 years or 40 years, as in bilateral oophorectomy or post-irradiation or medical oophorectomy or administration of chemotherapy. Again, this patient with all causes mentioned before needs hormone replacement therapy. Delayed menopause is cessation of menstruation after the age of 55 years, and rarely may be constitutional, but commonly due to causes associated with abnormal uterine bleeding. So this patient should be investigated well. If the patient had 56, 57, so after 55 years and still have menstruation, should be investigated to exclude all causes of abnormal uterine bleeding. Menopausal syndrome. As a last type of abnormal menopause, menopausal syndrome means exaggerated normal physiological changes occurring at menopause to become symptomatizing. A patient had local changes, a patient had general changes, a patient had central changes. All of these changes become exaggerated and the patient become complaining, so needing treatment. So management of menopausal syndrome depends upon clinical assessment first and then treatment. The psychological changes occurring at normal menopause, like slight anxiety or irritability or depression, now it is more and more evident. Anxiety, depression, irritability, insomnia, inability to concentrate, sense of end of life at a time with suicidal attempts. There is some vasomotor instability and hot flashes as heating sensation in the area of the back, in the chest or the upper limb, occurring day and night for few minutes up to few hours. And during this period of hot flushing, the patient can't tolerate heat, and followed by cold sensation and numbness. And at some time, due to severe osteopenia, osteoporosis, and easily fracture may develop. So the main complaints of menopausal syndrome: psychological, vasomotor instability and hot flashes, and osteoporosis. Hot flashes and osteoporosis again are considered as major symptoms. Yes, this patient had had hot flashes. This has osteopenia, yes, and this has osteopenia, complaining of pain or backache, and this has hot flashes. She is searching for fanning to tolerate her hot flashes. And this has psychological changes. Regarding other changes occurring at menopausal syndrome, a patient more liable for cardiovascular changes with palpitation, chest pain due to ischemia, arrhythmia, increased incidence of hypertension and ischemic heart disease, and gastrointestinal tract abnormality like decreased appetite, distension, dyspepsia, constipation, and dyspareunia, senile vaginitis, genital displacement, and senile endometritis. Again, all of these changes occurring general or cardiovascular or local or central, mainly due to deprivation of estrogen. Yes, how to investigate? We should investigate the female by FSH, LH level and estrogen. Yes, FSH and LH will found increased and estrogen will be found decreased. Mammogram should be done with pelvic ultrasound and bone densitometry for patients complaining of chest pain and those complaining of bone aches. DNC and biopsy if there is vaginal bleeding, despite the state may be senile endometritis or senile vaginitis, but DNC should be done. Before discussing the treatment of menopausal syndrome or artificial menopause or premature menopause, remember definition of menopause, normal age of menopause, factors affecting menopause, types of menopause, and the normal changes occurring at menopause. Yes, Now, for treating menopausal syndrome or premature menopause or artificial menopause, there may be general lines of treatment or medical lines of treatment or hormonal lines of treatment. Regarding general lines of treatment, there should be reassurance and better to manage it in special centers like geriatric center. Till here about the events that will occur, and it is a change of life, not the end of life, supporting the female psychologically. Give her good diet and high tonics and like Chinese herbal tea as it contains estrogen. Do small infrequent regular exercise. Give her calcium or foodstuffs containing calcium, vitamin B supplementation or alendronate sodium. This helps calcium and the vitamin D deposition in bone. Psychotherapy, sedatives, vitamins, minerals, and beta blockers to avoid hot flashes. And lastly, hormone replacement therapy. Please, hormone replacement therapy should be presented as a last line of treatment. Treat general first, followed by. What about hormone replacement therapy? It is indicated mainly in risk patient for ischemic heart disease or patient risk for osteoporosis or have symptomatizing genital atrophy like dyspareunia and atrophic vaginitis and endometritis, or presence of psychological factor, or premature or induced menopause. Hormone replacement therapy should be contraindicated in all cases with undiagnosed abnormal uterine bleeding or those having endometrial carcinoma or family history of endometrial carcinoma, present or past history of cancer breast or family history of cancer breast, and those having impaired liver function indicated by hyperbilirubinemia and liver disease or gallstones, or those having diabetes, hypertension, or ischemic heart disease. Again, patient have abnormal uterine bleeding or undiagnosed abnormal uterine bleeding, history of endometrial carcinoma in the family, or history of cancer breast or family history of cancer breast, or hyperbilirubinemia, liver disorders, and gallstones, those having diabetes or hypertension or ischemic heart disease. The lines of hormone replacement therapy mainly containing estrogen leads to many complications like carcinogenicity, defective liver metabolism and impaired liver function, nausea and vomiting, abnormal uterine bleeding, increased risk of thromboembolic disorders and pulmonary embolism and cerebrovascular disorder, and some complications like contraception. The main lines of hormone replacement therapy include continuous unopposed estrogen or progesterone, continuous combined estrogen and progesterone, cyclic unopposed estrogen or progesterone, cyclic combined estrogen and progesterone, cyclic androgen or tamoxifen, and non-bleeding agent like what's called tipolone, and phytoestrogen like clemadienone, and lastly gonadotropin releasing hormone analog but not used. Estrogen could be used as many routes. Actually, it is the main line of treatment. It is the most effective but dangerous. It is precancerous, leading to abnormal uterine bleeding, increased incidence of pulmonary embolism, cerebrovascular accident, impaired liver function, and so on. It may be given by oral or non-oral routes like skin cream or skin patches or estradermal gel or intranasal or sublingual tablets or vaginal creams or vaginal suppositories or vaginal ovules. But estrogen after a long time, 6 months or more, leads to abnormal uterine bleeding and its carcinogenic effect will appear. So, estrogen may be given in combination with progesterone to antagonize the effect of estrogen. Progesterone alone is less effective. Some may advise to give androgen to be turned inside the body into a weak estrogen, but again it have yes androgenic effect like virilization and masculinization and hirsutism. This is skin patch of estrogen or estroderm patch. other types including a small dose of estrogen and a small dose of androgen, or selective estrogen receptor modulator like tamoxifen, which was used in treatment of cancer breast, but a long time it acts as estrogen and found to increase liability for endometrial hyperplasia and endometrial carcinoma. Tibolone is considered one of the best treatment replacing estrogen, as it has an estrogenic character on bone, preventing osteopenia and osteoporosis, progesteronic character on the endometrium, preventing hyperplasia and preventing abnormal uterine bleeding, and the androgenic character on the vulva, increasing its blood supply and increasing libido. So, considered as one of the best line of treatment. Again, it has a specific action on the endometrium and no side effect on the breast. As other lines of treatment of hormonal therapy for menopausal syndrome or artificial menopause or premature menopause, we may use phytoestrogen like soya bean. It has mild estrogenic activity but no growth stimulating effect on the endometrium, or gonadotropin releasing hormone but not in common use, together with alendronate sodium or biphosphonate and calcitonin. Lastly, could you define the climacteric period? Yes, it is a period of transition from childbearing age to the menopausal state. Premenopause, yes, 5 years before the age of menopause. Premenopause, yes, 5 years before and 5 years after the year of menopause. Postmenopause, all the female's life after the cessation of menstruation. Precocious puberty, do you remember? Yes, we know puberty starting from 9 up to 14 years. So precocious puberty means occurrence of puberty before the age of 9 years, 8 years, 7 years, and so. Could you enumerate the types of menopause? Yes, either normal menopause needing no treatment, normal according to age, according to changes. Premature menopause, menopausal syndrome, artificial menopause, delayed menopause, induced menopause. Are lines of hormone replacement therapy. Hormone replacement therapy include either estrogen alone, progesterone alone. Both of them could be given, yes, cyclic or continuous. The cyclic manner is better, or combined as a cyclic or continuous. Yes, we can give also tamoxifen, or a small dose of androgen, or phytoestrogen, or yes, gonadotropin releasing hormone analog, or yes, alendronate sodium together with calcitonin. What about general lines of treatment and the medical lines of treatment for menopause and the menopausal syndrome? Yes, you should start by general lines of treatment like psychotherapy and psychological support of the mother. Give her analgesic, give her beta blocker, give her vitamin D, give her calcium. Okay, and the hormonal therapy, mainly estrogen, should be the last line of treatment to avoid its complication. Thank you.